All right. Okay, I'm recording. All right. I sure thank you so much for participating in this for me. Dream knows all about this since she just graduated with her BSN. So, Miss Renee, I am graduating in December with my bachelor's, and one of the projects we have to do is about national patient safety goals. And I know that you're familiar with JACO and how they visit us. And one of the criteria is to reduce infection. And by doing that, by doing proper hand hygiene, we can reduce our infection risk. So that's why I'm doing this, and I really appreciate you both listening, okay? So we're gonna go to the next slide right here. And like I said, the National Patient Safety Goal is a program created by the Joint Commission, and it's to help organizations identify areas where patients may have safety risk. And the goal that I identified to present for my project was reducing the risk for healthcare associated infections by using hand hygiene guidelines. They suggest using the guidelines formulated by the Centers for Disease Control or World Health Organization. Okay. The Centers for Disease Control and Prevention report that approximately 90,000 people die from healthcare associated infections each year. That's a lot. And hand hygiene, we know, is named the number one most important task that healthcare providers can do to reduce the risk of infection for our patients. Oftentimes we see healthcare workers go into a room and they're touching things. Even if they're not touching the patient, they're still touching personal belongings, and unfortunately, even those inanimate objects can carry bacteria. And other times we think that using gloves is sufficient, and we don't use our hand hygiene before or after. And unfortunately, when we touch the gloves, they have been contaminated, so they are contaminating our hands. Okay. The World Health Organization reported that with proper hand hygiene, 50% of healthcare associated infections could be prevented. That's a lot. So let's see here. Okay, well, according to the Centers for Disease Control and Prevention, many factors such as time constraints, lack of proper supplies. I know we go into the rooms and it's empty, and so then we're stuck. Those things can cause us to not perform hand hygiene like we're supposed to. Also, healthcare workers feel that sometimes they're washing their hands so much, their hands are irritated from washing so much. But we got to remember that even through this even when we don't see the organisms, they are most definitely present. And although we're busy, we need to consider putting our patients and ourselves at risk for infections. All right, the World Health Organization lists 5 moments for hand hygiene. Of course, 1 is before we touch the patient. 2 is before we're doing any kind of procedures. 3 is after we've been in contact with bodily fluids, even if we have gloves on. And then 4 would be after touching the patient. And then 5 is after touching even the surroundings in the patient's room. So those are all important times that we would want to provide hand hygiene for ourselves to protect our patients. In different settings, healthcare providers are in contact with many patients with a plethora of illnesses. Just by shaking each patient's hand or by touching a table or a handle in each room and not washing our hands between patient rooms, we are continuing that spread of germs. The first patient we see, they may have C. diff. Then we go to the second patient and we haven't washed our hands. They have the flu in the second room, but unfortunately we have C. diff on our hands. We spread that to the second patient. The third patient may have rotavirus, and so on. As you can see, that fourth patient is immunocompromised, and they have received all those germs from us. So unfortunately, we see that it's very important, and that was only 4 patients. Think about how many people we come in contact with each day, and just even amongst ourselves, I borrow a pen from somebody. So as you can see, germs can easily be spread unless we break that cycle. One journal article that I read, the authors use the information for cleaning hands from the World Health Organization and the Centers for Disease Control. They suggested those as well. They also remind us that as nurses, we spend a majority of our time, nurses and patient care techs, with our patients. We're with them more than most anybody. So it's our responsibility to use excellent hand hygiene. We need to perform hand hygiene with every entry and exit from a patient's room, as well as in different procedures, to reduce the spread of healthcare associated infections. Another article I'd read was a very interesting study, and it used the use of an automatic light. As soon as a human being entered the room, a light would come on for 3 seconds over the sink, and it would just kind of prompt you to go wash your hands. And they had a control room and then also the room that had the light. And after so many times, it was amazing. By the end, from habit, even going into that first room that had the light, healthcare providers would still use the sink and wash their hands in the second room, just out of habit from seeing that. It was very interesting. Okay, and then the third area that I'd read about was the Centers for Disease Control and Prevention. They tell us that the use of soap and water is necessary for when hands are visibly dirty, but it's best to use an alcohol-based hand rub as much as possible to reduce microorganisms that aren't seen. These hand rubs are also found to be less irritating to the skin than washing with soap and water, as well as reduce time spent performing hand hygiene. You kind of think alcohol-based and it's going to be more harmful to our skin, but it actually is not so. Studies have shown. Many medical facilities, just as ours, we have the hand rub dispensers right outside the rooms, in the rooms, all throughout the areas so that they're accessible to us. It's important to report when supplies are depleted or empty so that they can be replenished and ready for future needs. Healthcare providers that are based in surgical positions will use different types of soap for aseptic hand hygiene. The CDC recommends placing the recommended amount of alcohol hand rub in the palm of one hand and then rubbing it between our palms and then throughout our hands and between our fingers until dry. And then when we're performing hand washing with soap and water, wet hands first, and then use the manufacturer's suggested amount, and wash your hands in between fingers and tips of your fingers for at least 15 seconds. And then you want to rinse them thoroughly and dry with a clean paper towel, and then use the paper towel to turn the faucet off. Only use lotions that are provided by the facility, because they can break down the effects of the hand rubs and soaps that are provided by your employer. They also can break down the materials that the gloves are made of as well. All right. Sorry, y'all. This was the World Health Organization. They give a nice visual demonstration of how to perform proper hand washing as well when our hands are visibly dirty. I know we're all pretty familiar with this, but it's nice just to have a refresher. And then although we may think we have reasons to skip hand hygiene before or after patient care, it's obvious that performing this simple intervention can only be a benefit to our patients, our families, and ourselves by decreasing the risk for healthcare associated infections. And it's no wonder why it's important and listed as one of our national patient safety goals. Any questions? No? All right. Thank you so much, ladies. I really, really appreciate it.
You're welcome.
Thank you. Thank you.